morning, it's 11 a.m. here in Seoul. I'm Oh Soo-young at the Arirang News Center. We're breaking into our regular programming to bring you a live briefing from the South Korean health authorities on the coronavirus outbreak here in the nation. In just a few moments, we'll cut into the briefing at the Sejong government complex with simultaneous interpretation for you in English. We're going to go into the briefing room now where Kim Gang-lip, Vice Minister of Health and Welfare, will be sharing the latest figures and updates on the COVID-19 situation here in Korea. So at the Sejong government complex, the official there will be briefing us about the latest number of infection cases, and it looks like he's just taken to the podium, so the briefing's just about to start.
And we are also joined by Ms. Lee Jung-min and Park Yong-jun of the department head of the PR department. And we also have the sign language translation. Here is Mr. Kim Gang-lip on the briefing of the COVID-19 response. Let us now begin our regular briefing for June 24th, Wednesday. As of today midnight, we have 31 new local infections and 20 new imported cases, adding up to a total of 51 new cases today. And as of midnight today, we have a total number of confirmed cases that stands at 12,535. A total of 1,324 people are in quarantine undergoing treatment. We had no additional fatality yesterday, and the death toll remains unchanged at 281. This morning, KCC held a meeting presided over by Prime Minister Chung Se-kyun, and he touched upon the quarantine measures put in place at the ports, and also measures to intensify quarantine for restaurants, and also the plan to diversify and disperse the public servants' summer vacation. And Prime Minister Chung Se-kyun also said that regardless of the climate and the weather, we are still witnessing a global outbreak of the pandemic. And here in South Korea, we are also seeing cluster infections centering around the metropolitan area. And he stressed that we need to continue to be on alert. And he says that as cluster infections continue, this is leading to increased fatigue among medical practitioners and adding burden on the country's medical resources. He said that we need to effectively utilize our medical resources that are available at our hands. And recently we are witnessing cluster infections, and also which is spreading from the metropolitan area to the Chungcheong province and other regions. And we are also seeing continued increase of the imported cases. And however, those we have maintained a sustained confinement of these cases at the quarantine efforts at the airports, and they are not leading to further cluster infections in the community, so we believe that this is a good sign. However, we need to note that we are seeing a fast spread of the virus, and the speed of our tracking is actually lagging behind that of the speed of infection. And the government is continuing to exert our full efforts to contain the virus, and all of the ministries and the local governments are also cooperating closely to look at the blind spots of quarantine, including the door-to-door businesses, logistics centers, as well as the cluster areas where senior citizens live by themselves. And we are also extending our use of QR codes for entry logs. And as for 6 p.m. yesterday, we have also added the door-to-door business logistics centers, large-scale academies, and buffets as the high-risk facilities that need to comply with strict quarantine measures. We are also extending the use of QR code entry log and to enhance the convenience of such a system. And we are also monitoring the medical resources in order to enable utilization of effective resources. Although we at this moment we don't have a big burden on the further medical resources. However, we have a pan-government joint system to utilize and share hospital beds going forward. And as for the 16th of June, we also added one additional life treatment center here at the metropolitan area, and we have recently added another one. And also, we are witnessing some of the patients with no infectious rates of the virus being administered at hospitals. So we need to decrease the inefficient use of hospital beds in order to cure and treat the patients with severe symptoms. Together with the government's measures, we are cooperating with the public to find any blind spots in our community, and we believe that through this cooperation, we can delay significantly the speed of infection going forward. So we ask for the public's continued participation going forward. Next, we would like to touch upon the issue of Busan Gamcheon Port and the cluster infection there at a ship that has anchored at the port. And at the Busan Gamcheon Port, we have one ship that has anchored, and it has also unloaded at a port in Russia. And we have confirmed that after the unloading in Russia, the sailor has been tested positive. And also, we have 16 sailors being tested positive as for now. And we have one additional confirmed case at an adjacent vessel that has been anchored in the area. And about 150 contacts are being self-quarantined right now. And the port of Gamcheon will be temporarily closed for the time being. And as for the ships that are coming in through other regions, we have been carrying out quarantine measures only for those that have registered for such a need, and therefore there were some limitations, and there has been a lack of information exchange with other countries as well as within our ministries in South Korea. And we had also increase of the contacts as they had free movement within the region. And therefore, the government has laid out measures to intensify quarantine at the ports. And as for all of the Russian ports, starting from today that anchor in Busan port, we will carry out quarantine measures. And as for and they need to also report their conditions of all of the sailors to our authorities. And if they do not report these information to our authorities, they will be punished with fines and penalties. And also, we will also take these breaches to a possible legal action going forward. And in the process of anchoring, we will make sure that there is no massive contacts between the unloaders as well. And we will also maintain good quarantine measures at all of the facilities at the ports. And we will provide detailed categorized quarantine measures, and these guidelines will be provided in order to increase the efficacy of our quarantine protocol going forward. And as for restaurants, we also have laid out measures to intensify quarantine measures. Restaurants, as seen in the Jeonju city of Jeonbuk province, is also very prone to a widespread cluster infection. Therefore, the FDA of the South Korea has also provided the quarantine protocols as these facilities are 3C facilities, meaning that they are confined, crowded, and enclosed. And we will also utilize the use of takeouts and to limit the clusters and limit the crowdedness of these restaurants. And aside from eating, the times of eating, they need to also wear face masks. And we also will facilitate these restaurants to have partitions in between these tables to decrease the possible travel of respiratory droplets. And we will also mandate people to use hand sanitizers and use of hand washing means. And these protocols need to be put in place going forward, and we will also put in place measures to intensify mask wearing of the staff members there, and also isolate anyone who has symptoms, and also suspension of the businesses when they have a major breaches of such protocols as well. And we will also cooperate with the Agriculture Ministry and local governments to designate good models for these restaurants so that we can spread a new norms of culture going forward. Next, we have some of the updates on the dispersion of the summer holidays for public servants nationwide. And our Ministry of Personnel, we have designated such a policy so that the public servants will go on their summer holidays in dispersed periods. And they will be subject to all of the national and local governments as well. And the period of summer holiday will be extended to 12 weeks. And by week, we will make sure that people are taking leave in an equal position so that people can not only focus and concentrate on certain period of time as for their summer holidays. And this will be applied to all of the central ministries as well as local municipal governments, and also public organizations will be subject to such means. Lately, we are seeing continued cluster infections here at home and abroad, and we are also seeing a prolonged outbreak. And we believe that this will lead to a repetition of outbreak and this decrease in the number of new confirmed cases. And we need to also once again highlight the importance of complying with quarantine measures, including wearing of face masks and distancing. And they have also been proven at some of the high-risk facilities that had low number of cases after a confirmed case has been reported. And above all, it is very important that we need to continue to ask for the public's cooperation going forward. Thank you very much.
That was the Vice Health Minister there we just heard updating us on the COVID-19 situation. He just told us that there are 51 additional infection cases of COVID-19, bringing the accumulated total to 12,535. There are no new deaths, however, meaning that the death toll stands at 281. That wraps up our coverage of this morning's briefing. Thank you so much for staying with us, and we'll be back with our regular newscast at 12 p.m. Korea time. Bye for now.